I think we need to understand the nuanced mental health expressions that kids of color and in particular black kids, we need to understand what those nuanced manifestations of symptoms are, what they look like, how best to connect to them. What we know is that schools are the largest provider of mental health services, and social workers are the largest provider of those services. And so for social workers, there needs to be an understanding of what the signs and symptoms of suicidality might be, or the nuanced kind of expressions of depression, anxiety, or trauma that would help these kids get connected to needed services. What we see is that these kids are often suspended or expelled from school because of behavioral challenges. To me, that is at the heart of what social work is all about, in the sense of helping to right an injustice, but also righting that injustice by providing, requisite services. And so it's very much at the heart of what social work is in terms of practice. From a policy perspective,